Acyclovir. Acyclovir is a synthetic purine nucleoside analog that has anti-herpes activity. Acyclovir has anti-herpes activity. It is a synthetic purine nucleoside analog that has anti-herpes activity. Acyclovir is a synthetic purine nucleoside analog that has anti-herpes activity. It is more effective against HSV1 and HSV2 than varicella zoster virus infection. Acyclovir, it is a synthetic purine nucleoside analog that has anti-herpes activity. It is more effective against herpes simplex virus 1 and herpes simplex virus 2 than varicella zoster infection. Okay, it is a purine nucleoside analog. It is a synthetic purine nucleoside analog that has anti-herpes activity, more effective against HSV1 and HSV2 than varicella zoster virus. Let's see the mechanism of action of acyclovir. Acyclovir is converted to acyclovir monophosphate by HSV thymidine kinase. HSV thymidine kinase converts acyclovir to acyclovir monophosphate. HSV thymidine kinase. HSV thymidine kinase converts acyclovir to acyclovir monophosphate. Okay, HSV thymidine kinase. Then cellular enzymes convert acyclovir monophosphate to acyclovir diphosphate. Then cellular enzymes convert acyclovir diphosphate to acyclovir triphosphate, which inhibits viral DNA synthesis and viral replication. Acyclovir triphosphate inhibits viral DNA synthesis and viral replication. Acyclovir is converted to acyclovir monophosphate by HSV thymidine kinase. HSV thymidine kinase converts acyclovir to acyclovir monophosphate. HSV thymidine kinase. Then cellular enzymes will convert the monophosphate to diphosphate, then diphosphate to triphosphate. Acyclovir triphosphate inhibits the viral DNA synthesis and viral replication. Acyclovir triphosphate inhibits viral DNA synthesis and viral replication. Acyclovir is selectively taken up by herpes virus infected cells. तो जो herpes virus से infected cells है, they will selectively take up the acyclovir. And then it is activated to acyclovir triphosphate, activated to triphosphate derivative, which inhibits viral DNA synthesis. It is available for oral, topical and IV administration. So route of administration can be IV, oral and topical. Route of administration, IV, oral and topical. It is highly potent anti-herpes drug. It has high therapeutic index with low toxicity to the host cell. So route of administration can be IV, oral or topical. It is highly potent anti-herpes drug, highly potent anti-herpes drug, and it has a high therapeutic index. It has a high therapeutic index and low toxicity to the host cell. So it is selectively taken up by the herpes virus infected cell. इसका active form है triphosphate. ठीक है, acyclovir triphosphate. It will inhibit the viral DNA synthesis. Route of administration, oral, topical or IV. Highly potent anti-herpes drug. It has a high therapeutic index. High therapeutic index and low toxicity. Oral bioavailability is poor, poorly bound to plasma proteins, widely distributed in the body, freely crosses blood-brain barrier, excreted in urine. ठीक है, तो ओरली इसका जो बायो अवेलेबिलिटी होता है वो बहुत पुअर है, प्लाज्मा प्रोटीन से पुअरली बाउंड होता है, डिस्ट्रीब्यूशन बहुत वाइड है, इट freely crosses blood-brain barrier and excretion is in urine. Oral bioavailability is poor, poorly bound to plasma proteins, widely distributed in the body, freely crosses blood-brain barrier, excreted in urine. Now let's see the uses of acyclovir. Genital herpes, herpetic encephalitis, herpes simplex, keratitis, mucocutaneous HSV, herpetic whitlow, that is nail bed infection, chicken pox, and herpes zoster. So uses are genital herpes, herpetic encephalitis, herpes simplex keratitis, mucocutaneous herpes simplex virus, herpetic whitlow, that is nail bed infection, chicken pox, and herpes zoster. Genital herpes में oral intravenous topical acyclovir is effective in genital herpes simplex infection. It is used for primary and recurrent infection. High doses acyclovir are needed for recurrent infection. It reduces the frequency and severity of herpetic lesions. तो पहला यूज़ है जेनाइटल हर्पीस, इसके प्रिवेंशन और रिकरेंस को इनहिबिट करने के लिए. Then herpetic encephalitis. Intravenous acyclovir is the drug of choice for herpetic encephalitis, herpetic simplex keratitis. Acyclovir is used topically in herpetic keratoconjunctivitis. Keratitis या keratoconjunctivitis में topically used होता है. Mucocutaneous HSV. Acyclovir is used orally or topically in the treatment of stomatitis, herpes labialis, and ulcers in the mouth. It is used intravenously in immunocompromised patient. Herpetic whitlow or nail bed infection. Oral acyclovir is used for the treatment and prevention of herpetic whitlow. Chickenpox. Acyclovir reduces the duration of illness if started early in patient at risk of severe illness and immunocompromised individuals. Herpes zoster. Acyclovir and valacyclovir. Acyclovir and valacyclovir are effective in herpes zoster. The 7 use है genital herpes, herpetic encephalitis, herpetic keratitis, mucocutaneous HSV, herpetic whitlow or nail bed infection, chickenpox, and herpes zoster. Let's see the side effects. Acyclovir is usually well tolerated. Nausea, vomiting, diarrhea, and headache are the other side effects. High doses can cause neurotoxicity with tremors, confusion, disorientation, and convulsion. Topical use के कारण irritation and burning can be there. Acyclovir is well tolerated, usually well tolerated. Other side effects में nausea, vomiting, diarrhea, headache. Common nausea, vomiting, diarrhea, or headache. High doses can cause neurotoxicity with tremors, confusion, disorientation, and convulsion. Common side effects nausea, vomiting, headache, and diarrhea. High doses में there can be neurotoxicity with tremors, confusions, convulsions, and disorientation. High doses cause neurotoxicity with tremors, convulsions, confusion, and disorientation. Topical use, it causes irritation and burning. See, valacyclovir is a prodrug. It is converted to acyclovir. Intracellular activation of acyclovir to acyclovir triphosphate that inhibits the DNA synthesis of HSV1, HSV2, varicella zoster virus, and hepatitis B virus. Valacyclovir is a prodrug of acyclovir. Valacyclovir is the prodrug of acyclovir. It is converted to acyclovir. Intracellular activation of acyclovir to acyclovir triphosphate and this triphosphate will inhibit DNA synthesis of HSV1, HSV2, varicella zoster virus, and hepatitis B virus.